We very often have people asking about chronic ischemic small vessel disease, white matter hyperintensities, punctate lesions, other abnormalities that will be found on their MRI report. Generally, they're told the reason for the lesions are related to blood pressure, diabetes, high cholesterol, tobacco, other types of inflammation, and the individual generally will not have those medical conditions, so it leaves a significant question for them. A lot of good doctors will reference the reason for all those changes are related to aging. So you end up having a variety of different opinions, things that are very widely accepted in the field. However, none of that really gives a very good answer to help explain why the radiology report has the words chronic small vessel ischemic disease or white matter changes. Those terms are used in the reports, but the individual has to have completed an accurate evaluation. Sometimes the completed evaluation, even by a good doctor, is not as detailed as it needs to be because there are aspects of the coagulation cascade that sometimes get a little complicated. We find many of our cases that we treat end up having difficulties with a hypercoagable state. The full coagulation cascade drawn out here is very complex. There are many different aspects of your genes that could end up giving you a slight abnormality. The blood still remains either flowing or clotted based upon a very intricate dance of this coagulation cascade. One abnormality might not be as bad, but combine one abnormality along with another difficulty, such as some type of infection or inflammation in your body, and you may find that the body forming clots happens much easier. Typically, the factor deficiencies are very important. However, detection of additional antibodies that you may not have been born with but developed are also very important. As many of these things do run in families, we have very often had patients where one individual in the family has essentially blazed the trail for the rest of the family because once they identified a specific genetic factor deficiency, other family members were able to get checked, tested, and then appropriately treated.